What's up, beautiful people? In today's episode of the Fit for Fortune podcast, we're going to look at testosterone replacement therapy and what I usually tell my clients about it and when they ask me. In fact, from now on, I will just redirect them to this episode. We will also look at just general under-the-counter illegal testosterone use, how incredibly widespread it is at the moment, and we will look into the risks of them and what you should make sure of before doing them. Now, officially, TRT is when a medical professional legally prescribes you testosterone to offset the drop that you experience due to aging. So this is not just injecting for fun or to grow muscle or to get stronger. It's bringing your natural testosterone levels back to where they roughly should be. Full disclosure, I am not a medical professional. Anything I say here is purely fiction. And if you decide to try anything, do so at your own risk and do your own research, please. I've only ever had one client on testosterone. He was 56 years old. His readings were extremely low. We lost 23 kilos in 25 weeks. Naturally, actually, that was before we started injecting. And then we decided to go on testosterone after. And what happened was completely insane. Well, to me anyway, he completely blew up in a good way. I wish I could tell you that the whole testosterone thing doesn't work, but he built 16 kilos of muscle in 1 year without basically gaining any body fat. So that was quite unbelievable. And the reason I say I wish I could tell you it doesn't work is because it does come with side effects, and nowadays everybody's doing it. It's way overused. And obviously I don't mean TRT is way overused, but the under-the-counter version of it. You can see influencers going around gyms and asking random kids in their 20s and in their late teens about substance use, and it's crazy how many people are using it without regarding long-term consequences. So let's dive into the details and look at how these things would work legally. So from the age of 30, most men experience a roughly 1% drop in testosterone per year naturally. TRT, as I said, as the name suggests as well, it's supposed to replace that naturally dropping off testosterone and bring you back to physiologically occurring levels. For your doctor to consider putting you on TRT, you have to fulfill two criteria. One, you need to actually have low testosterone, so you need to measure it and be under 3 nanograms per milliliter. And you also need to have symptoms of low testosterone that are affecting your life. And these symptoms belong in 3 different groups. First one would be psychological symptoms such as depression, lower drive, lower mood, lower energy, and in general not feeling like yourself. There are sexual symptoms potentially, which can be low sex drive, low libido, low fertility, and erectile issues. And there could be the third, physical symptoms, where you experience muscle loss and loss of bone density. So first off, you start with taking the blood test, and if your serum testosterone is not low, then they will not prescribe it for you, and that's pretty much the end of the story. Now, there's obviously a valid question whether it's the same as with other government guidelines and other official recommendations. For example, the same as with protein, where the recommended daily intake is about 50 grams per day, but we know that if you intake more than that, it will keep benefiting you even past this level. So whether you really need to be that low with your testosterone in order to feel the benefits, if you genuinely experience those symptoms that I mentioned, that's a very valid question. Probably those symptoms would improve even if you're not as low, but you will still have a good chance of getting the side effects as well. So let's look at what those side effects actually are. So first off, there's a good chance of androgenic, so male features getting emphasized, potential hair growth in places where you don't want to grow hair, such as pubic area, on your back, facial hair, and hair loss from the place where you would want to keep the hair, which would be your head. Your voice can get deeper, your skin can get very oily, you can develop acne, and potentially increase sex drive, which, well, to a certain point, it can be an advantage. And obviously one of this, or some of these androgenic features that would happen are the ones that we are looking for, such as bone density increase and muscle mass increase. There's a decent chance of developing cardiovascular disease. The condition is called erythrocytosis, which just means red cell sort of dominance, where red blood cell production increases, and with it, blood thickness increases. Because blood thickness is higher, your blood pressure will increase, your heart will have to pump harder to get the same work done and to pump the thicker blood around. There's a higher likelihood of blood clot formation as well as heart disease. There can be mood disorders such as irritability and anger problems. Exogenous testosterone also lowers follicle stimulating hormone, and if follicle stimulating hormone drops, your natural sperm production will drop as well. If that goes down, your fertility goes down as well. Again, this is why it's not very recommended to take it from such an early age, especially these kids that don't even need it. Their naturally occurring testosterone is so high, they're the least in need of any extra testosterone, really. You can develop gynecomastia, which is fat gain around the chest. Basically, the excess testosterone can start converting into estrogen, and with the increased estrogen, you can sort of start developing female sort of fat patterning, hence the body fat gain on the chest. And this can also come with chest discomfort, tenderness, pain. You can develop prostate growth. This can be benign prostate growth, or if there's any sort of cancerous things happening there, then that can be sped up as well. Potential liver issues. And I think a huge thing that people don't realize is that you cannot just jump on testosterone and then come off it and retain all the benefits. So if you're genuinely experiencing any of those symptoms listed, as soon as you jump off testosterone, they will come back. Similarly, a lot of my clients ask me if they can just potentially go on testosterone, build some muscle, and then come off it and retain the muscle. And the answer again is no, because you don't have the sort of hormonal environment to sustain all that muscle. So I think the lesson here is threefold. One, once you start taking testosterone, you pretty much need to do it forever. And ideally, you're wise enough to start doing it later in life, if at all. So basically only if you really genuinely need it. And the last one is that because the risks are so high, I recommend that you do anything in your power that basically can increase your testosterone similarly without carrying all these risks. So why would you take on the extra risk if there are other ways of improving on your testosterone? So I think in general, as a rule of thumb, the better overall health someone is in, the better their hormonal environment will be as well, the more optimal it will be. And when I say overall health, I do mean biological, psychological, as well as social aspects of their health. In the next episode, I will talk a little bit more in detail about these things that I think anyone should take off when they consider going on testosterone. What those are, we will look at recovery, nutrition training, lifestyle, as well as supplementation factors.